Hi, my name is Miles Guyton. I'm a general dentist practicing in San Jose, California. My journey at IDEA began when I asked the same long-standing question and received a different answer. And the question I would always ask is, why do patients in good health and excellent hygiene still continue to get decay and bone loss? When I ask my colleagues this, they might say things like, well, perhaps when they were young they had poor hygiene. This led to cavities, large fillings, and then crowns. Others would say it's due to poor root form. And then others might say, well, it's genetics, they just have soft teeth. In 2014, I had a patient come in with a toothache on the lower right. It was an old PFM that had some chipped ceramic and some recurrent decay and mild bone loss. Since I can't change her genetics, I feel like my only solution is to change the material. So I go to her and I say, there's this new material that's much stronger, I think we should give it a try. She agrees. We place the new crown and everything goes well for a while, and then about a year later she comes back with a toothache in the same spot. When I take a look, the crown's intact, but then I find a vertical root fracture. So you can imagine her disappointment when I tell her we're going to need to extract and place an implant. She said she understands and she thinks, I think I inherited my bad teeth from my parents. So now I'm treatment planning an implant at IDEA, and then I asked them the same question. How do you think this happened? And is the implant going to do any better? And that's when I got an answer that totally surprised me. They said, no, we should take a step back and look at this case. Do you see how our teeth are lingually inclined? Do you see how there's this pattern of posterior restorations? And if you take a close look at our joints, you're going to see they're flat on the ends. This happens when the teeth are in the wrong position and the jaw is restricted. When this happens, what do you get? You get decay, bone loss, and fractures. Now, I had been practicing 20 years and I had never heard that before. So now I have a new question. And my question is, how do we treat it? And that's when my education began. That was 6 years ago. And now I can say my life has totally changed. My practice has changed, the nature of it. I went from being a one-tooth dentist putting out fires to a comprehensive dentist. And I think more importantly, the quality of care my patients received is greatly improved. If you have a similar story, you should strongly consider studying these concepts at IDEA. I'd love to see you there.